1.5 million Jamaicans may catch COVID-19, according to Health Minister Dr. Christopher Tufton, who has advised us that only a minority of those infected will need hospitalization. But with the country now in the community transmission phase of the virus, do the numbers really matter at this point? We don't know, do we? I'm Ashley Ann Foster, and you're watching Hardline. We're going to be right back after this short message. Stay with us.
One of our most prized departments is our lumber treatment plant. It is one of the most modern and state-of-the-art treatment facilities for lumber in the entire Caribbean. Our lumber is bought in raw form. They are then carefully loaded into a pressurized cylinder where it is treated with special chemicals. After the internal treatment process is completed, the lumber is transferred from the cylinder to the drip pad where it sits to be naturally dried. Our plant has the capacity to treat 50 million board feet of lumber annually. Not only do we treat our own lumber, we also offer lumber treatment to our valued customers.
Thank you for staying with us. You're watching Hardline. On March 10, Jamaica confirmed its first imported case of COVID-19. And of course, we were all distraught and dismayed. So we called upon the government to do all that it could do to stop the virus from reaching our shores. Dr. Christopher Tufton, the Minister of Health, urged us all as Jamaicans to follow the protocols.
The Ministry is also urging the public to adhere to infection prevention and control measures as a standard operating procedure. In fact, it is more important now than ever, which includes maintaining a distance of at least 1 meter from persons who are coughing or sneezing, frequently perform hand hygiene by washing hands thoroughly with soap and water or using a hand sanitizer if hands are not visibly soiled, cover our mouths and noses with a tissue when coughing or sneezing and then discarding it, and resist the habit to touch our faces.
That same day, Prime Minister Andrew Holness made his own statement and assured us as Jamaicans that the government has the situation under control.
The government of Jamaica is prepared to deal with the occurrence of the novel coronavirus COVID-19 in Jamaica. The Ministry of Health has been fully mobilized, and our technical and professional experts and technocrats have been sensitized. I have every confidence in our medical professionals, our public health officials, and our administrators in managing the situation.
And as you'd expected, Prime Minister Holness urged us as citizens to take personal responsibility.
So go about your normal business. However, pay close attention to the advisories and information provided by the government. Increase the awareness of your own health and the health of those around you. Until a vaccine is found, the greatest means of control is smart and informed human behavior. Panic and spreading false information are not smart behaviors. Every Jamaican must take personal responsibility for their health, hygiene, and travel.
Since then, wear your masks, wash your hands, sanitize, and stand 6 feet apart have become a part of the Health Ministry's messaging as it seeks to flatten the curve and slow the spread of the coronavirus by encouraging us all to take personal responsibility. But despite the Health Ministry's efforts, Jamaica still entered the community transition phase of COVID. So this indicates a difference in how the virus is spreading, as Prime Minister Andrew Holness recently explained to us.
The transmission of the virus can no longer be easily traced from one member of the population to another through a chain of transmission. It also means that the virus is no longer confined to clusters, but is now island-wide.
The Health Ministry has urged persons 70 years and older to remain particularly careful due to their vulnerability to the virus. However, younger individuals who are likely to be asymptomatic are being asked to be more sensitive because as younger persons, we may unknowingly pass on the virus to our older relatives. And you know, we live in multi-generational homes. So us being at risk as younger persons puts everybody at risk. Our grandparents, our parents, and even dogs can get coronavirus. So we have to be careful. In response to the community spread, the Health Ministry has made operational changes, signaling a shift in the ministry's focus and in our national focus. But one thing is for certain, keeping the economy open is at the forefront of our changes.
So community transmission does not envision totally shutting down the economy. Indeed, it envisions managing the spread to ensure that the economy continues to function.
Since the first confirmed case of COVID-19 in March, the Health Minister has consistently provided updates on the number of new cases via social media. But with the shift in focus, the changes also involve how the ministry is going to be communicating with us as the public.
The update on the COVID-19 numbers will be provided by 10 a.m. each day, reflecting the verified numbers of the last 24 hours. Access to those numbers will be provided through our website.
This new approach by the Ministry of Health also involves a more deliberate effort to teach people how to live with coronavirus, rather than just saying that we're going to live with it.
So the conversations will now zero in on living with COVID in a real sense, whether through testimonials, updates, expert commentary, looking in the respective environments, at the workplace, focusing on life with COVID as opposed to just about how many cases we have today.
As usual, Hardline is going to do you justice. We went into the streets to get your take, and this is what you had to say.
Yes, it affected. Yes, it has affected because the people, them not buying us first. They're not buying us first time. So I'm saying that maybe they're afraid or something like that, you know.
It affects us because through the COVID, most of the people are not coming out because they're afraid. And them are hold on for the money. Them not spend the money because they want to buy food. Because they don't know when the country will lock down or whatever. You understand? So it affects me in every way.
Well, them not manage it good enough because guess what? You see, from the first one did come in, if the government did just close, we wouldn't have this epidemic go so far. Because look about somebody there. If me usually come and work like 12 in the afternoon, me not come 12 again, I come like about 6 because they have curfew for 8 o'clock. So I just come 6, because you know people come out early now for do what they have to do for just to get to beat back the curfew. So we just work with it.
It might go on good. Yeah, but you see who I'm put in a quarantine, let me tell you, and then come out and lock them up and charge them.
You're watching Hardline. We're going to be right back. Stay with us.
ARC is one of the leading manufacturers and distributors of building materials in Jamaica. We have been serving our global customers and partners, from builders, contractors, interior designers, with innovation leveraging technology, superior quality, service and efficiency for almost 20 years. At ARC, we are committed to ensure that all products are adequately stocked, and by achieving this, we have managed to be one of the premier carriers of the largest inventory in Jamaica.
COVID-19, what do the numbers mean? How serious is it? And most importantly, what is the plan? Joining us now via video link are the President of the Nursing Association of Jamaica, Carmen Johnson, and Dr. Winston Dawes, acclaimed medical doctor and contributor to the national discourse. Now, Dr. Dawes and Ms. Carmen Johnson, Nurse Johnson, can you paint us a picture of what things look like now in the hospital from your medical professional perspective? Nurse, let's start with you, then over to Doc.
And so what things look like, good evening and thanks for having me. Presently, our facilities remain in a state that they were prior to COVID. And in saying that, what I'm really saying is that we continue to have ward spaces that are over-occupied. And so not just because of COVID, but because we have had a number of individuals who continue to have their illnesses, non-communicable diseases and other conditions, emergency conditions. And so what we're having are a number of wards that are still full. Patients are waiting in our accident and emergency departments for admissions. The challenge now with COVID in the hospital facilities is that you have a number of patients who, though they did not come in for COVID, are now being tested positive for COVID. Because what you'll find is that patients like for surgery and other conditions are being tested on admission to know how to proceed with their care. And so what we're having is that we're having a number of patients who we know who are COVID positive, who are on the COVID wards, as we would refer to them, and patients who did not come in for COVID who are presently on the other wards.
When you say on the other ward, nurse, when you say
your medical ward, your surgical ward, your pediatric ward.
With persons who are not infected with COVID.
Right, because they did not come in for COVID, but having tested them or they start developing signs and symptoms, they are now diagnosed with COVID. Coupled with the fact that we now have community spread, we see the hospital as a community within the wider society. And so we are now having our own community spread within the healthcare institutions. Okay. And so a number of our healthcare providers would have now come down with COVID also. And so what you have is that persons having to be pulled out of service to either be in quarantine or in isolation.
Okay, this is a great point for Dr. Dawes to give us his perspective. Doc, you've heard what Nurse has said from the doctor's position. What's happening in the community, within the community?
What's been happening now is that with community spread, there is no way of tracking who has been infected. And we are not capturing all the numbers because a fair percentage of people won't have any symptoms and they won't come in contact with the health systems to be tested. And they have the capacity to spread the infection. In addition, we have people who have been tested, found positive, and instead of self-isolating or quarantining themselves, there's a report of one taximan who has been found positive, yet continues to work. He's putting the public at risk because he'll be in a confined area and his passengers will be, communicating with him and probably inhaling the droplets with the COVID virus.
How was that case discovered, Doc? The taxi man.
I think somebody saw him.
And he had previously tested positive for COVID, and he was still operating his taxi.
Yeah, still operating his taxi. And then when you talk about medical, nursing, the porters, etc., they are having to see patients coming in, especially those in the COVID ward who would be people who would be quite ill. They'll be having to treat people who are very ill, and sometimes they would have spent hours or days treating them, trying to get them well, and then have them pass on. So there's a psychological strain on these doctors and nurses, and it has, in other jurisdictions, had a negative impact on their mental health.
Correct.
So it is something which we're going to see a lot of and a lot more over the coming weeks and months.
Are we seeing that though, Nurse Johnson? Psychologically, do you feel that your nurses are being negatively impacted to the point of suicide as yet?
No, they have not reached a point of suicide, but I will tell you that many have become frustrated because you'll turn up today and you would be on your regular ward working, hoping that things would be the norm because you have your 10, your 15, your 20 patient, because the work burden is still high. Fast forward before COVID, we were 45% or more short staff in the nursing departments. And so you find out with COVID and its added burdens where persons now having to be working long hours or working to help to keep the other areas up and going. Persons also having to be pulled out of the facility because they're in isolation or quarantine. You have less persons now carrying the work burden. And so having to take on that increased numbers, not knowing also if you have COVID or the patients that you're treating with have COVID, coupled now with the new mandate where you don't retest an individual after they have tested positive and have served their period of quarantine, you allow them to come back. It is seek to be creating more disease and discontent among our members.
So that's the protocol,
many become
nurse?
frustrated and fearful.
What is the protocol? You just said that persons aren't retested.
Well, the new protocol
when?
that the Ministry of Health had highlighted to the public was that based on the WHO guideline, there is no need for you to retest after you have been diagnosed as a positive COVID patient. But you wait your quarantine period, and once you have not developed any signs and symptoms, then you are good enough to go back into the system. Our members still have concern about that, and that creates dis-ease for them, and it creates discontent because they're uncertain as to whether or not the person had
Dr. Dawes?
or whether or not they're cancer.
This regimen, are you familiar with it? And if so, what are your views on it?
No. The thing is this, that we have to retest people to make sure that they are not still infective and that whatever immunity they have developed, that it has conquered the disease. But we're now finding that there are cases where people sometime after have been proven to be infected, got better, and they find the virus is still around in their bodies. And they're not sure exactly how much of a spreader they can be, but it is still there as a potential risk, both to their co-workers and to other patients.
What would the most ideal testing regimen be for healthcare workers?
The ideal testing regimen for healthcare workers would be test on a regular basis, once a week. And then if they do become infected and quarantined, then you have further tests until they are negative for at least 2 weeks. So they're going to be false negatives and false positives.
False negatives, false positives. We know, Nurse and Dr. Dawes, that we have a balance of payments problem still. So how are we going to afford all of these things? And should we make a sacrifice in another portfolio or from another part of the budget to ensure that we can keep up with what we need to keep up with to stay COVID-free?
No, I was just saying my view and my opinion, having a discussion with my members, is seeing that the country has now said, the Ministry of Health, that they are not able to test as many persons as we think we should and be doing the retest. My view and our view is that what we could do is do a sample of those individuals who have so been tested positive, have sat out their quarantine isolation period, and should be coming back, that we pull a sample of them and test them to determine whether or not the virus has really left these individuals, or are we still finding a certain percentage with the virus, which would then inform us as to how we proceed forward with the protocol or not with the protocol.
Okay, Doc, to ask a question which correlates with that. Persons in other countries are able to test privately. I know that we have started some private testing, but what about persons having access to the COVID test, which is almost akin to the pregnancy test, the rapid test kits? Why can't I have one now and test everybody in the studio?
No, you still need professionals to do the test. It is not something which is not a pregnancy test. You need to have professionals doing it. You need to have people trained to do it. And you need equipment to make sure. And this, I think, given all the circumstances, has to be the most important thing facing Jamaica now. If we don't get a grip on the COVID infections, then whatever balance of payments problems we're having now, it will get worse.
Nurse, how do you feel about that?
When we were in the earlier phase of COVID, we know where most individuals were quarantined, that they were quarantined or isolated in various facilities. And so you know that the risk of having 100 persons moving around with COVID was limited. No, you do not know how many persons have it and where they are going, and persons are really not staying home. And many persons, though you continue to ask them to wear their mask, they're really not staying home either, and they're not wearing the mask. And so we are going to be seeing increased numbers. And the more you test is the more you'll know the burden and being able to plan for what will happen within the healthcare delivery process. Because with our wards presently as they are, and if we should now have persons moving about more, they're going where the elderly persons are, where those with their chronic or their communicable diseases are, you're going to be finding out that many of those persons are going to be becoming sicker as we move down the line if COVID continue to rise.
Okay,
and so we must be able to test to know how to cordon off.
Okay, so let's hold that thought. We're going to take a quick break. Hardline will be back right after. Stay with us.
One of our most prized departments is our lumber treatment plant. It is one of the most modern and state-of-the-art treatment facilities for lumber in the entire Caribbean. Our lumber is bought in raw form. They are then carefully loaded into a pressurized cylinder where it is treated with special chemicals. After the internal treatment process is completed, the lumber is transferred from the cylinder to the drip pad where it sits to be naturally dried. Our plant has the capacity to treat 50 million board feet of lumber annually. Not only do we treat our own lumber, we also offer lumber treatment to our valued customers.
You're watching Hardline. Thank you for staying with us. Of course, we're going to jump right back into the COVID discussion. Dr. Dawes, I have to ask you, we're told by the government that 1.5 million of us, almost half of us, are going to contract COVID-19. Is that a real threat or is that just talk?
No, it's a real threat. If you look at human-to-human transmission of various new diseases, then we get very, very high infection rates. And if you look at the flu epidemic of 1918 to 1920, where it is said between 50 and 100 million people died, and you can also extrapolate from that that a very, very high percentage of the world's population were infected but recovered.
How did they do that? How did they overcome it? It seems so difficult for us to overcome. Was it this difficult?
No. The vast majority of us who get infected won't have symptoms that will be very mild symptoms. The ones who are at greatest risk would be where the immune system is compromised, either by some of the, we talk about the comorbid diseases, diabetes, asthma, heavy smokers, renal failure, heart disease patients.
Yes.
They are more prone to suffer the consequences of being infected. But especially for the younger people, they tend to have a milder disease than they would for those of us in the
Is that why young people aren't taking it seriously, nurse?
I think so. And what we must recognize is that I think that's why they are not taking it serious. But what we need to recognize, looking at what has been happening across the globe, and even amongst ourselves, those patients who we have in Jamaica, young persons are coming down with the disease. And if we are not careful and our immune system becomes weakened for any reason, then it can have devastating impact on our young individuals. And so they must take it serious, because high numbers of us based on history of disease and viruses are going to get it. But it's how do we take care of it? And many persons, though they don't have any comorbidity, they have not really been maintaining themselves in peak conditions. And many of us may have weakened the immune system because of the stresses that we undergo, even the stresses of having to work on the type of work that we do. And so when that does weaken our immune system, it can have serious implications and impact on our health. And so young
Dr.
persons...
This weakened immune system. Now, Jamaicans, we only go to the hospital or the doctor even, unless, we don't go unless we're very, very, very sick. Now, do we have a false number? Are we getting the truth about COVID, about where we really are, what our R number is, what our spike level is? Because we don't like to be sick, and it takes a lot for us to go to the doctor.
That's true. And the fact is that we have not been doing a lot of mass testing. And with community spread, the only way to really find out would be to get people to come in on a semi-voluntary basis and be tested. But you'd find that a lot of people would not be coming in because there is no safety net, that if they come in are found to be positive and have to quarantine themselves for 2 to 3 weeks while they're still feeling healthy, they're not going to do it. And so it's going to have to be more aggressive. What they've done is that people coming into hospital for whatever reason, they're testing and they're finding that a lot of people who are asymptomatic are actually positive. So you can imagine if the people who have some condition are being found to be positive, that's what is happening in the general population.
Yes, you just referred to the economics of it, especially when you brought up that taxi man. We could picture that man has to go out to work in his mind, despite the fact that he's COVID positive, he can't survive. Now, what about scorn? In the beginning, there was a public campaign, don't scorn persons with COVID. Is that still relevant? Should we be doing more of that?
We should be, because any one of us are vulnerable. And it can, regardless of who you are, regardless of your wealth or your whole, or how young you are, you can be infected. And so we need to get people to understand that it can happen to you or me or anybody. And so if you start scoring people, then that means that they're going to try and hide it, and it's going to put more and more of us at risk.
Now, doc and nurse, persons have been complaining that, okay, they're flu-like, they have a little chest issue, some of them are asthmatic, some of them aren't, they're coughing. They go to a place like St. Joseph's to try to get a test, and their name is written down on a list and nobody calls them back. I know one individual who had to have a private test and pay $20,000 for that private test because the government system, the public healthcare system, failed them and they turned out to be COVID positive. Is that foreign to either of you?
No, it's not foreign. And what you have to understand is that the public health system has always been under pressure, and this pressure has only made it even more difficult. And what you find out with the numbers of persons that have to be tested based on one reason or the other It's a high number. And what they also do is do a risk assessment. And depending on where you fall on that risk assessment questionnaire that they would have done, then they'll determine if you need to be tested now or you need to be tested later. Coupled with the fact that we are in community spread, and it is accepted that a number of persons are going to be having it. They are going to be having mild cases of it, but individuals will get better. They will throw it off like what we do with the flu, hopefully, that you'll find that not everybody will get tested. And again, our resource persons to do the test, to do the risk assessment is limited. So you will have backlog, and persons have been complaining about having to wait after they have made contact. And so it's nothing new, and it is not something that we can easily get through today. And so it's going to take some time.
Dr. Dawes, how satisfactory is this? How many lives are going to be lost because we say we don't have enough manpower to do risk assessment, which I'm sure is probably just a piece of paper, probably like this, that somebody fills out?
It's going to be difficult, and I think that we're going to have to try and put all of our resources into this. This is the biggest crisis that the world has faced in a century, apart from World War II. But World War II was confined to small theater, in the war. This here is affecting everybody. It's a brand new disease, and we are learning about it as we go along. And they're now finding that even some people who thought they were asymptomatic or had a mild disease, that they have chronic problems, with the lungs and the kidneys, etc. So it is something which we are still learning about. And I think that we have to try and put as much in the way of resources into it to try and get a better feel for what's going on.
Has the response been satisfactory for you, nurse, in terms of patient care, in terms of your professional perspective? Has Jamaica been doing enough? We were praised at the beginning of the COVID scourge. Are we still praiseworthy?
The healthcare workers are still doing enough, doing what they can do, and have been going beyond the call of duty since March, because some days they work 14 days without a day off, not able to take leave, not able to take care of the family member. But as the Jamaican populace, we are not doing enough that we should do, because we should be seeking to see everybody as being COVID positive, including yourself, and to ensure that you're protecting yourself and you're protecting those around you from COVID positive.
But what about the government response,
The system
nurse?
itself needs to look at where we are, because the system needs to ensure that we are better able to test more individuals, and that for individuals who have the challenge as to how to quarantine or isolate at home, and because they know their home setting, they prefer not to complain that they're having the sign and symptom, but continue to go about their business and to maybe spread it. That way, the society, the system needs to create places and spaces for those individuals to go to be tested and also to be isolated or to be quarantined.
Dr. Dawes, how do you respond to that? Now, the policy, from a policy perspective, government sets policy. The healthcare workers work within the policy paradigm set by the government. Is the government response enough? Are we still praiseworthy as we were at the breakout of the epidemic in Jamaica?
Well, no. What we have to do is to look at the circumstances and really, the case workers, people doing the contact tracing, that if somebody is found to be positive, that there is regular contact with them. But it can't leave it up to the individual to make the choices as to whether they're going to obey the rules, because so many people operate on a hand-to-mouth basis that if they don't work for a day or two, then they starve. There will be also the circumstances where they live, that they do not they can't self-isolate, because it might be a relatively small house with a lot of the people being there, and they can act as a nexus for spreading it. So they're going to have to start looking at how we can get people to isolate in various spaces where they won't be able to contaminate others. It has to be a greater response. As I say, it's the most serious thing that we face. We have already seen where the biggest travel agency in the UK has canceled trips to Jamaica because of the risk of getting the COVID right here. and that Britain, which was the original source of many of our cases that came into Jamaica, they are now quarantining people who come from Jamaica back to England for 14 days. So it's not something we can take lightly. We have to get a grip on it, and that has to be the priority over everything else.
Do you both feel that we have enough medical personnel in the system now? A couple of weeks ago, if not over a month, there was a cry from persons in the medical field that there are not enough jobs, there's not enough space for them. I read on Facebook that 50 doctors who qualified overseas are waiting to be qualified here in Jamaica or approved. Is that true? And should we be making more room and loosening the budget in the face of a crisis to ensure that we have enough medical personnel to deliver the care that we so need at this time?
We don't have enough medical personnel, and I'll say we don't have enough nurses. Because before COVID, we had just approximately 52% of the nursing staff that we needed to staff all of our healthcare facilities across the country. And what you find that is happening is that it's not like you can pick up healthcare persons to just come. Nurses have to be trained, doctors have to be trained, and it's a process and it takes time period. Our hope though is that we know we have some nurses who have graduated and they have done their RENR exams, and we're hoping that they'll get their results by next month. And so the hope is that the system will have them out there belingering as they did years ago, and these nurses had to find other options. But once they have received their results and they have been licensed, that they will employ them within the system. Because again, our local nurses understand the language better, understand how to intervene, and is able to hit the ground running. Though again, the system and our ministry, their panacea is to ensure that they bring in expatriates to fill the needs, which sometimes takes some time for you to get to where you want to go.
Hold that thought. We're going to take a quick break. Stay with us on Hardline.
ARC is one of the leading manufacturers and distributors of building materials in Jamaica. We have been serving our global customers and partners, from builders, contractors, interior designers, with innovation leveraging technology, superior quality, service and efficiency for almost 20 years. At ARC, we are committed to ensure that all products are adequately stocked, and by achieving this, we have managed to be one of the primary carriers of the largest inventory in Jamaica.
Thank you for staying with us on Hardline. We've been talking about COVID-19 with the president of the Nursing Association of Jamaica, Nurse Carmen Johnson, and senior medical practitioner, Dr. Winston Dawes. And now joining the conversation, you're going to want to hear this, is the president of the Medical Association of Jamaica, Dr. Andrew Manning. Dr. Manning, thank you for joining this conversation with us. And of course,
thanks for having me.
Thank you. We have to ask right away, because it's on Twitter, it's on Facebook, the doctors are bawling out. What is the plight of the doctor in the hospital, the plight of your members?
Well, we are all under stress, especially the doctor on the front line. We are seeing increases in the numbers of cases. There are issues in terms of adequacy of PPEs, having the appropriate PPEs for each interaction with the particular patient. There are issues in terms of just the patient load coming in. And this on the background of the fact that the hospitals are already under strain. One of the other things you would have seen in the social media and in the mainstream media that several of our hospitals, including the bigger hospitals, are already being stretched thin. They're close to full capacity. And we are still, depending on what model you use, still in the early days of this pandemic. So we are all under stress. And in addition to that, we also are persons, the doctors, especially those on the front line, and nurses, are at increased risk of getting COVID-19. So clearly when you're interacting with the patients, you have that in the back of your mind.
Okay. Dr. Dawes,
No.
can you support Dr. Manning here? Not enough PPE.
Yes.
And we're seeing
enough,
on
that-
social media
yes.
as well that there is a cry about ventilators. What is the true number of ventilators that we actually have in Jamaica? And do we have enough operators? Should we still be in this position having experienced months of COVID? Do we have the reagent? Enough?
Well, as I've been saying, I mean, it's difficult for us to be sure what the numbers of, reagents, ventilators, etc. I know we're a little short at the beginning, but after the initial rush in the States, they found that they did not need as many ventilators as they thought they would. So the shortage of ventilators worldwide is not as acute as it once was. But we need to get the doctors and nurses who are going to be dealing with the intensive care. That is where the major problem is going to be. And the people who are working in intensive care are going to be potentially having a high viral load, because these are people who would be very ill, would have a lot of virus within them, and putting those staff at risk. So we have to get the personal protective equipment up, and we've had enough time to try and get them in place.
How are we going to do that?
If not,
How do we just get it up?
No, buy them. I mean, there are a lot of people who are now producing them. And, certainly the Chinese, I think the Vietnamese reacted very quickly and started producing the PPEs after a few months. And it's for us to go out and get them, because you can't be asking the staff to put themselves and their families at risk to be treating patients who are ill, need the intensive care, but yet we are not providing them with the equipment to protect themselves.
Nurse, do you have a
from these
perspective?
patients.
Nurse
Yes,
Johnson?
I do. Just to say that over the last number of years, the country having not appreciated the work and the worth of our nurses, many of our critical care nurses migrated. And so we are without those experienced and skilled persons. What I do know that the ministry had tried to do the other day was that they had some crash course in nurses being able to manage patients on the ventilator to some extent, but not to the extent that a trained critical care nurse will be able to do that. One of the other challenges that we have, and that have come to our attention from our ICU nurses, is that based on the fact that we still do not have adequate numbers of PPE, that they are being told that you don't need to be worrying about using your N95 mask for patients in the ICUs. And we are saying, no, if they are that sick to be in the ICU, don't wait until I'm going to be taking out an endotracheal tube or putting in, or I'm going to be nebulizing. I need to ensure, and we need to ensure that our nurses and our healthcare workers have adequate numbers of the N95 masks to protect themselves and the gowns and the things that they need in order to care for these individuals. And so what you find is there's a rationing of the N95 mask. So where I may be on a medical ward or a surgical ward, which is not a COVID ward, you'll find that you have patients who have COVID, but you are being told that you may move towards a resuscitation, not to remember that, you need to stop and be cautious. And when you have done that nebulization or resuscitation, you recognize that, oh hell, this patient was COVID positive and you didn't have an N95 mask to use.
Wow.
And we're saying all wards should be so stocked, or not stocked, but at least give them a certain numbers to keep for emergency situations such as those.
Dr.
Because
Manning?
nurses are very concerned.
Dr. Manning,
The issue
any other
with the
observations?
PPE is definitely a challenge. For the N95 mask, you need to have particular types. we found that particular brands work better than other brands. And in addition to that, when you bring in a particular type of N95 mask, it has to be fitted, seal fitted for that particular doctor, okay? So we really need, as Dr. Dawes said, for the authorities to procure many more masks, many more PPEs, but also have the structures in place so that you can have adequate seal fit testing moving forward. We're in the early days of COVID, right? We're in the early days of COVID. Now, Nurse Johnson mentioned something about persons being asked to interact with patients in particular situations without the right PPEs, and that is a total no-no, right? If you do that, you're gonna have the healthcare practitioners becoming ill unnecessarily. We have to fight tooth and nail as a country to procure the proper PPEs at the proper levels to make sure that the healthcare workers, when they're on the front line dealing with some of these patients, you have to have the right PPEs.
Have you made any intervention, starting with you, Dr. Dawes? Have you made any advocacy? Have you done any advocacy in relation to this matter of PPEs and shortages of staff?
I have, using my forum, but as far as influencing policy, I don't have much influence there. But, I do a radio program and I speak about it. But as far as having an impact on policy, I think Dr. Manning, as president of the MAJ, would have a great impact, and also as a hospital doctor, that they should agitate towards ensuring, one, adequate number of doctors being employed, and two, that the proper equipment is in place to protect the doctors and the nurses and the porters. Let us not forget that porters are also, ward assistants, that they are also a part of the medical team. And then to get the proper testing, they're going to have to really ramp up that so that we get a true picture of what's going on in the community.
Okay, what's the plan now, Nurse Johnson? Living with COVID as healthcare professionals, living with COVID as the citizenry of Jamaica. How would you advise us?
That as citizens of Jamaica, to include both healthcare workers and the regular citizens, we now have to accept that COVID is here, COVID is going to be around, and that we all have personal responsibility to ensure that we are protecting ourselves, we are protecting the next individual beside us, we are protecting our communities, and we are protecting our parishes. When we reach that level where we recognize that I must play my part and I must do what I must do to protect myself and others, because anybody could have it around you, then we will be better able to survive, while the Ministry of Health and the RHAs must seek to provide the necessary resources, the necessary places and spaces for individuals who may have COVID but are challenged at their home, that they can go there to ensure that they wait out their isolation period or their quarantine period, and that they are able to access the level of healthcare that they need. I also want to say to those who have their non-communicable diseases, take your medication, try as best as you can to stick to your diet, because coming into the healthcare facilities means you're also now putting yourself at greater risk, and also means that you may come in and you can't find a bed space or a chair space. And so we have to accept the personal responsibility to remain well and to stay well.
Okay, Dr. Manning, do you have similar advice? And from your perspective as a president?
Certainly has been advocating for increased levels of PPEs and more staff. In fact, we have up to this point been in regular communication with the Ministry of Health officials, and we continually push for it. But also at the front end of this, the public has to play its part in terms of trying to flatten the curve. We hear persons saying that they don't believe in the COVID and they're not wearing a mask, and you see persons walking around and not wearing a mask properly, not social distancing, having parties, that kind of thing. And it makes a difference. The thing with COVID, because it is going to pass through Jamaica, we have to slow it down so that we don't get more critically or moderately ill persons that we can manage at any one time. We have about now in Jamaica about 100 ventilators, which is a marked increase than pre-COVID days. But you need to have trained persons to run the ventilators, and that number of ventilators can be filled up very quickly if the rate of increase of COVID is too much. So flattening the curve, although it sounds boring, right? It is very important. And when persons in the public are thinking about this, remember what they do will have an impact on the healthcare workers on the front line.
Absolutely.
All right?
So Dr. Dawes,
if their relatives can get treatment when they come to the centers.
and we appreciate the work that the MAJ is doing in that regard. Dr. Dawes' personal responsibility to build on what Dr. Manning has said. Can you talk to us a little bit about that, especially with regard to young people and also enforcement? Is the government to do some more to enforce the measures, the punitive measures that have been put in place to ensure that we do our part to flatten the curve?
Yes, they have to. You cannot have people walking around in crowded spaces going, I see people lining up to go into the Western Union, sometimes at the banks. They are standing side by side, not wearing the mask, and that is putting everybody around at risk. And and then they're speaking, so they're producing the droplets, which can infect everybody around them. We're going to have to insist that people are forced to wear masks when they're out, and also to warn them and to have a serious education about the risks involved. I mean, we've heard of parties on boats where the rich and famous were there partying, having a good time, and a lot of them ended up having been infected with the COVID, and some of them probably need oxygen. And there are rumors of people who were flown out by private jet to Miami for treatment. It is a serious disease. It puts all of us at risk. It is not a flu because, unlike the flu, for those who get lung damage, it involves the entire lung. While the flu might just be patches, this can have very, very serious effects. And there can be long-term damage to your heart, your lungs. There are neurological problems involving the brain and the nerves. So it is something very serious. And we don't know if those who are asymptomatic, whether they're not going to have long-term consequences.
Thank you so much, Dr. Dawes, Dr. Manning, President of the NAJ, Nurse Carmen Johnson. That's all the time that we have for today, but join us next Sunday. We're here every Sunday at 6. This is Hardline. I'm Ashley Ann. Thank you so much, and we'll see you next week.